win is that I was digging around in old thyroid data from 20 years ago, and I found this nodule that had not been followed up. And my win is that I had an ultrasound with my primary care doc and had like a healthy communication with her about stuff.
I love that.
Yeah.
By the way, so you had a repeat ultrasound. What happened with the nodule?
That's about twice as big as it was in 2011.
Right.
But it doesn't have any weirdness. Like by their standards, they say, oh, well, it's sub-centimeter, so there's no need for follow-up. And she kind of repeated that in her little note. And I said, hey, Dr. Mimi, I have a Mimi and a Maggie now. I said, I think this needs to be followed up. I don't know on what frequency, but I want to in the future. I don't want to just let it go, because that's to sort of that would be just waiting for it to turn cancerous, and I'm not doing that. So I want to follow up and see it shrink or stay the same or go away.
Well, by definition, the fact that it's doubled in size means that the causation of it didn't stop, right, which is the underlying autoimmune attack.
Right.
By definition, if the causation didn't stop and the size doubled, this is an autoimmune attack against your thyroid. And what's the risk? Someone with autoimmune issues of the thyroid and a nodule, what's the rate of risk of thyroid cancer in individuals with thyroid nodules? 10 times more than the general population.
Yep, not acceptable.
It is absolutely asinine and not acceptable. And I love the fact that, you showed by your actual ultrasound results what not attacking the root causes caused. Right. And also people just say, oh, it's benign, has no features. It's doubled in size. Mm-hmm. And we know these nodules have 10 times more of a risk of thyroid cancer. So it is absolutely not acceptable. And I appreciate that you took what you learned here and learned to have a collaborative conversation with confidence.
Yeah.
I mean, did you feel bad asking for surveillance of this thing?
No, not at all.
Okay.
I'm taking care of business. That's,
your life.
Yep.
Your life. Okay. And the other thing is that what have you learned in this program to actually prevent further damage of your nodules? What have you learned that will actually shrink these nodules and decrease risk?
I kind of threw some of that stuff into the conversation with her too, and she took it very well. I mean, it was like, we'll be having more conversations about the steps that I'm taking to take care of my body. And
and humor me, Susan, seriously, use the Thyroid Protect, use the selenium, and repeat this ultrasound in 6 to 12 months, and then show her the proof.
Yep.
Absolutely. 100%. And then I want to see you share that one in the alumni group.
Okay.
When you have a repeat ultrasound in 6 to 12 months and see where it is.
Will do.
Congratulations. Thank you, Susan.
Thank you. Thanks.